It is Monday, September 20th, 2021. Welcome to Perspectives. Wherever you are joining us this morning, we're happy that you are waking up and moving with us on this broadcast. Those of you carrying the broadcast live, we welcome and we thank you as per usual. MTV on air and online, Mikey Live, TNR Communications, Partygrenada, our own Perspectives page, KG9, and Sister Isle in Carriacou. Thank you, everyone, and welcome. I am Brenda, Baptiste, your moderator, and here we are again once more for some fresh, nuanced, and other perspectives, as the program is so aptly called. It's our pleasure to introduce our expert talk panel of Senator Christopher Allie here in studio, and Mr. Byron Campbell zooming in this morning. Good morning, gentlemen.
Good morning, Brenda, and good morning to our viewers and our listeners. It's another Monday, and we're happy to be here again to have a chat about what is happening around us and what we see going on. I had a very interesting Friday. Friday, I volunteered for one of the pop-up clinics that was done in the right next to my company, Sissons Paints.
Fantastic.
Very interesting. When I get to talk about that. I thought,
okay.
But I want to say one thing about the pop-up clinics. I think it's an excellent initiative that was put on by the Ministry of Health.
Yeah.
I think it's certainly achieving its objective of getting people tested to understand their status, as well as helping with the vaccination effort. But I think even what is even more important, I think you're seeing a lot of Grenadians coming together, uniting to help in this initiative with government, private sector, and other folks. And let me tell you, Brenda, one of the observations I make, we have some really hard-working medical people when it comes to... We were in that field by me there from around 10 in the morning, setting up, getting ready, and so on. We started promptly at 12 o'clock, and we probably concluded at around 3:30, and it was constant.
Yeah.
It was constant in terms of the flow of the people, and people coming to get tested and vaccinated, either first dose or second dose. So it is really a good initiative, and I think when you see the amount of pop-ups that have been happening all around the country over the weekend and what is happening, our medical personnel are really doing human service. I don't know what other adjectives to use, but to say how great and how well they're doing and the sacrifice they're making. And I mean, we're not even stopping.
Sacrifice, that's the word.
Yeah,
that's
not even stopping to say we take a break for an hour for lunch or half an hour and we stop the flow of people eating while they're walking and taking a little 5 minutes here and there. It was really amazing to see that spirit among our people and what we're doing, because we all recognize that it's a crisis. But the most critical takeaway from me, Brenda, after looking at that and being there, is that so many of our people still don't understand what COVID is about.
No?
Yes.
No?
And from the questions I got there from people who are coming and so on, you get the sense that a lot of people are still not clear what this virus is about, how contagious it can be, and the effects of it on them personally, whether it is getting them seriously ill if they're not vaccinated and so on. A lot of folks really don't understand that. And that was a major takeaway from me, knowing that we're almost 2 years into this situation with COVID. And
I took that away a while, because I paid attention to how people engage. So on social media, whenever people are interviewed in the news, and so even people who were on panels and platforms, and even some experts, how they presented on various issues, it's clear that just how the actual virus, how it works, how it spreads in terms of the days, the amount of time it takes the viral load to show up, how much time you need to be isolated, the duration of time for clearance of the virus in the body and all of that, why you need to do X, Y, Z, why that is happening. Those very basic things still seem to be absent in terms of people's analysis. And it's just really and I think that is what drives a lot of people's behavior, because if you're not too sure about something, then it becomes, you're not clear what you're doing, so you're approaching it in a certain way. And then when you hear people who you think, if you are an ordinary person in the grand scheme of things, and you're hearing from people who you expect to know, give you a point of view, that's what you're stuck with. So that forms the decision you make, So it is a lot of that, but here we are learning as we go along. Mr. Campbell, good morning.
Morning from
Ooh, tie.
You love the tie. Byron.
Should I say thanks to Mrs. Campbell?
Something, you think, and morning all colleagues. I'm kind of lost for words. I want to focus on the positive within the whole pandemic, and listen to this. What are the positives here? I heard over the weekend or late last week that the Public Workers Union were advocating to their membership the importance of being vaccinated, and I think that for me that's a big deal. Where the unions are coming out now in a public way, in a big way, and encouraging membership. That's what we need. That's good. I think also what you were raising there, Chris, the question of volunteerism, where this is going. There's been a call for it, and certainly we're seeing not only locals, but non-nationals also. Someone was saying they need to see more local doctors, especially those that receive scholarships from Grenada. That's just a thing. But the point is we have volunteers coming out, medical and other persons coming out, non-nationals, and that's a positive also. I also want to remind us, all Grenadians, that in 2014, Grenada received an award from PAHO, the Pan American Health Organization. And this award was for the most progress in vaccination programs, So we have that in us. We understand vaccination because we've been doing this better than very well, let me say. I'm not comparing us with anyone. So that's a good thing. What we also seen we have an average of about just over 300 persons being vaccinated every day. That's a good thing. We want to see those numbers go up. We want to see more positives. We all need to pull ourselves together on this because we are more than 2 weeks into restriction of movements, in terms of curfews, in terms of lockdowns, in terms of so many small businesses and individuals, because people, these are livelihoods that depend on this for their welfare, for their well-being. So we have at the same time the effects there and the issues or the affecting our both security, which the police force, and our health system, the challenges there and the effect there. So we have to overcome this and the economy, the effects on the economy overall. So whereas I think we're making some progress, Chris, Brenda, we have a long way to go based on where the numbers are still, in fact, spiraling upwards, averaging for the weekend, for example, we've had in terms of registered just under 600 persons, and these numbers are going up because we're doing a lot more testing. So there's a relationship between the level of testing you're doing and the positive cases we're seeing.
Yeah, the community mobile testing and vaccination, I think that is working really, really well in terms of, I think it's giving us a really clear picture of where we are with COVID. Very, very, very clear picture as to where we are. And so it's providing us with data now that funnels into the decision-making process as it relates to, restrictions and how we move on. And so on Friday or Saturday, they included on the COVID dashboard, which is really, really good, the number of tests done in that day. So we saw on Saturday the number of tests done, and yesterday. So I think Saturday was like 1660, or yesterday was 1660, and Saturday was another 1,000 and something. So in those 2 days, what we're seeing from the dashboard is that over 3,000 tests were conducted, and we came back with XYZ results. It's also, as you go deeper into the communities as well, I'm sure they're getting a feel as to the profile of COVID in Grenada, where it is, who it is impacting, and so on. So now I'm sure at some point somebody could say, well, families are most affected. We're already hearing that women are largely affected. And then we have to start looking now at children, because children are within families. So going into those communities and so on, you know, I must say kudos to the Ministry of Health on that. You know, one wish that maybe in hindsight, and maybe going forward, if our numbers continue to go the way they're going, that we start looking at isolation, state isolation. It is clear that we just, whatever you tell us to do, we're going to do the opposite, it seems. It seems that something is conditioned within us, and we seem that we want to do that. So we say go home, isolate, you come in, you test positive, we say go home, isolate. You don't, you know, you go, it depends on, and another thing, it's not just behavioral, it's also a social thing, because we have to consider where do these people live, right, Senator Allie? Is it a shuttle house with 2 bedrooms and 10 people? Is there a grandmother in there? Are there 5 children in there? How many men are in there? How many women in there? Do they sleep? You know, that kind of thing. So we need to start getting to that. I remember in August, sometime when we started to get COVID, and I said it, and I raised the point that I think maybe as people are tested, we should introduce the shelter system, the shelters as the isolation, and have NADMA controlling. And I thought maybe the health people and the police, it would be more streamlined and efficient in terms of managing. I remember the time I made a post, somebody called me up and they said, quite a few people agreed with it and made comments on Facebook, and somebody called me and they say, but Brenda, I didn't expect that from you. Y'all stigmatizing the people, yada, yada, yada. And I thought about it for a bit. And I thought, okay, this is how society works. If all these people go into shelters, there may be stigma. But stigma? I mean, thinking about stigma as to what's happening now?
It takes stigma.
Man.
You know,
whoa.
I want to say that part of this issue with community spread that we need to understand as well is the whole issue of how much people it's taken away from the workforce.
Yeah.
And it's one thing to have, 2,000 positive cases plus heading to 3,000. But it's the other thing with the primary contacts. Mm-hmm. When you take out one worker, for example, that is positive, you take out probably 4 or 5 people that person has been in contact with as primary contacts. Mm-hmm. So the effect on the businesses are significant in terms of our productivity and what is happening. And then the question becomes, how long can we continue that way? And how long can the livelihoods aspect of it be for us to maintain that as business people? Mm-hmm. Because this last 2 weeks, locked down quite a number of businesses that were deemed unessential.
Right.
And apart from the lockdown weekends. And the question now, as I suppose when we talk to Minister later, is how much longer can we continue to do this? Mm-hmm. Because my view is that, Brenda, you know, because community spread touches behavioral patterns more so than anything else, at this stage, I am not certain how lockdowns are going to assist if we don't change behavior.
Or manage it.
Or manage it.
Change and manage.
But
you have to go hand in hand.
It's a burning question now, because we need to understand, as Minister did say, once these lockdown weekends were concluded and curfews and so on, they will assess to see the value and whether or not it changed or flattened the curve or provided us with any sort of indication that we get in this. But I am quite certain that for the week gone, we had more than 1,000 cases show up on the radar.
Absolutely.
Based on the daily average. Absolutely. And when you look at the amount of testing that was being done, as you said, in one weekend we did 3,000 tests. In one day by me we did close to 300. I am not sure how many of them were positive.
Right.
But in that sense, you get a feeling that our positivity rate now, a couple of weeks ago, the doctors said it was at 30%. I'm sure it's approaching 50.
Last week I said 30%. Well, there is a projection that we would get to 50, maybe in the next week or two. We're probably very close.
Which means
only our medical people can tell us. But in so far as change behaviors, appeal to the good sense of folks. But then it comes a point where behaviors need to be managed. And I raise my hand because I think my hand heavy.
Yeah, and I want to add I want to add to that. No,
So
the messaging needs to change too.
we need some heavy-handedness when it comes to behaviors. If I am tested positive for COVID, I have to isolate. If I, in my thinking, figure that, to them, I could go in the rum shop, I could ride a bus. It may be a case of necessity too, where I'm a mother. I have 6 children at home, and I just came from the health center and tested positive. But guess what? All I have at home is flour. I need to get rice. I need to get sugar. So you see where I'm coming from? Mm-hmm. So there needs to be an intervention between these two dynamics, right? Of the nonchalant who doesn't care, and the person who out of necessity must move. Because people don't get that. There are people, it's survival. They have to move. So how does the state then, with all the other pressures already and all the other management concerns, how then does the state address that? Because if that is not addressed, we shall spiral into more of what is happening.
Yeah, and it really becomes, as I've said before on this program, it really becomes one of looking in the mirror and seeing how you could change what you can do. But that point you're raising about families being affected with a main breadwinner being positive and what happens thereafter with nobody else to assist is a real serious concern as well.
It is a serious and real concern.
Yeah. But I want to say, I think our messaging needs to change. Byron, yes, I want to get your view on this messaging. I think now in our community spread, I believe the messaging now have to go more to interviewing people who have been positive, who have been vaccinated, who have not been vaccinated, and get testimonials and see if that brings a message, as we say, of encouraging people to change or modify their behavior patterns to try and see how we can mitigate this situation or the spread that we have.
Chris, I want to endorse the general comments you've made.
30 seconds, Mr. Campbell, the minister is waiting.
As we evaluate where we are in the pandemic, the present situation, the messaging and the targeting, because we know from the data we've had recently is that we know that we have much higher numbers of vaccination taking place in the southern part of Grenada. In St. George, for example, the parish of St. George. So the thing is, we have to have that messaging has to be focused on rural communities and young people in particular. You know, I think, I want to agree with that, and I know of different organizations working on this. I know we are working on this, and I agree that the testimonials are going to be important, you know, who people trust, who people understand, who people can relate to. You know, that kind of messaging, I think, is important. But Chris, you raise an important point there, which is the ongoing debate. The question is, at what point you raise lives and livelihoods? At what point we are in, and you talk about it, particularly small business, non-essential businesses, and even existing businesses. How do what's the strategy going forward as we balance this lives, livelihood, and the challenges with the security and health? At what stage is the numbers going to guide us here? Is the science going to guide us here? What is the standard we're going to use, or what are the factors? What are we going to put into the equation to evaluate, to determine what is the best strategy going forward? Not just the best strategy, but which one is the most equitable, the safest one? You know, because I think lives, you know, I heard, and I need to say this, you know, the doctors, I think it was Dr. Charles, you can see the stress and the frustration and the trauma in him. And he was using words that not often used by doctors. He was talking about being able to salvage humans, you know, lives, you know. And that tells you about the dire situation that we in, you know, and how we go forward.
Yeah, we have to we'll pick up our conversation later, gentlemen. Just remember where we were, because we need to get from Senator Allie, Mr. Campbell. What happened last week up by the Senate, boy? Everything can't be COVID in her. We had to laugh. Hello.
I'm happy to talk about it.
Was Mass up there?
I was in the chair.
Friend, I got very concerned. I wanted to come up in
Tell us.
After we talk to the minister.
Anywho's, we have the minister waiting in the wings for us. It look as if this is his Monday morning date. And I wonder if he wake up looking forward to coming to see us. Anyway, we'll be right back with our Minister for Health, the Honorable Nickolas Steele.
Get vaxxed. It's your best shot. Hello.
A message from the Ministry of Health.
Are you gonna wear your mask today? You see everywhere you go. There are rules you got to follow, so don't you say COVID-19 will delay. Take the opportunity to save your community. Don't be that guy, put a mask on your face if you're heading outside. It's your life, my life, more lives will be taken if we don't try. If you feel any symptoms, call the hotline. Stay inside until you feel fine. 6 feet away every day. Keep COVID-19 far from away. Keep Grenada safe. Be COVID-19 smart.
Welcome back to Perspectives. If you're just joining us this morning, it is a pleasure for us to introduce to the special panel the Honorable Minister for Health, Nickolas Steele. Good morning, Minister.
Good morning, Brenda. Good morning to you, Chris and Byron, and to all of your viewers and listeners out there.
All right.
Morning,
So we
Minister.
know that you're moving, so we're working with audio this morning, and we thank you so very much, knowing the many calls you have on your time, and you're here with us this morning. Minister, our second weekend of no movement, mass community testing, and we see that our vaccination numbers are going up and all of that. But more importantly, though, the state of where things are tomorrow at at midnight Tuesday, the current sets of regulations would run out and all of that. So just give us some sort of brief as to where we are in terms of our COVID situation, what you are finding out, what your experts, so to speak, are finding out now as to where the science is going now that we've had 2 weekends of lockdown and everything that has happened over the course of the last 2 weeks in terms of our COVID mapping. What can you tell us about that?
Well, Brenda, let's start from the beginning, which is that once you transition from a cluster outbreak to community spread, the disease has to run its course. You have methods of intervention. You are restricted with the types of intervention that you have because Our society has its limitations in terms of periods of lockdowns and movement, and you have psychological stress, etc. And you create other problems with further restrictions, etc. So what we are seeing are the required changes. We will continue to see a death rate, but I urge you to now look on our daily dashboards. It is not as important to simply look at the number of positive cases, but to look at the number of positive cases as a percentage of the total number of tests done.
Right.
That will give us what is referred to as your positivity rate.
Right.
We are seeing, and Dr. Sean Charles had referred to that last week at our last post-cabinet briefing, and that's where he was able to make the determination, supported by PAHO and WHO and all other infectious disease experts or so, that we were looking at last week about 30% of the was a 30% positivity rate. So if that was extrapolated, you could say that 30% of your population. We are seeing a decline in that positivity rate. So the restrictions on movement, and in particular the no movement weekends, etc., are reducing the amount of people that are getting infected, which is what we want, which is how you get back control once you have community spread. And these no movement weekends also are affording us amazing ability to get out there and test even more than we can test on any day of the week, and also vaccinate better than we can on any other day of the week.
Right, right. Yeah, interesting, because I did, a friend of mine did point out that that change on the dashboard on Saturday. And so I was able to, early this morning, to look at Saturday and yesterday to see that over 3,000 tests were done. And we came away with close to 537 thereabout positive cases based on those tests. So you're saying that is the kind of information folks should look at to get a sense of what is going on in the national community regarding COVID, right?
Yes, so yes, that is in particular one. The other is, yes, our hospitalization rate as well.
Right.
That keeps us, that also is one of the key factors, because we want to keep that as low as possible, obviously.
Right.
Hospitalization as well as death. But we also need to recognize that if that rate, hospitalization rate, keeps increasing significantly, we totally inundate our health system, because the hospital is not just there for COVID patients. The hospital is there for all the other services that our hospital provides. And if you inundate it, then you stop those services as well, and you end up having deaths, non-COVID related deaths, simply because the healthcare system is inundated. So those are the two factors that merit or cause further or continued intervention of any form or fashion, not just in Grenada, but anywhere else in the world. So those are the ones that persons can look at to see how we are doing, so to speak. But what I think we all need to recognize is that once you have full-blown community spread like we have, the disease has to take its course, so to speak.
All right. And of course, taking its course is a certain amount of time and days. You mentioned the lockdown weekends yielding the sort of information you needed scientifically to adjust how we respond nationally. So question one, should we expect to see more of those lockdown weekends in the new regulations coming out? And additionally, hospitalizations in the broadest sense, if we continue to see hospitalizations on the rise, not going down, of course, isn't that directly linked to mortality as well, or deaths?
On the first question, Brenda, we are deliberating today. So yes, we have taken it down to the wire with respect to the decision. because so much information comes up based on the fact that we have so many teams out on the weekends doing the testing and vaccinations, etc. So that is why the decision for extension. And we knew this, which is why the current actions expire tomorrow. It is with the understanding that it is on the Mondays, not simply because Monday is cabinet, because we can have emergency cabinet meetings any day of the week. But because coming out of these no movement weekends comes the most valuable bits of information. So later on today, expect an announcement as to the direction we would be taking. With respect to hospitalizations, yes, traditionally, hospitalizations are also the harbinger of death rate. But what we have found, not just in Grenada, and not just in the CARICOM countries, but also even in our French-speaking countries, in Guadeloupe and Martinique as well, who have gone through their significant waves, that person stayed home in denial, or person stayed home using other remedies, etc. And by the time persons called medical teams, it was too late. So we want to avoid that as well. And we are seeing that here in Grenada as well, unfortunately, that by the time persons are calling for an ambulance, the ambulance is responding in time. But by the time persons are calling for the ambulance, it is too late for the medical team.
Yes.
Now, so the testing and the going out there on the weekends helps significantly, but because it helps us to reach out to certain people, especially persons who are shut in and unable to move about. It helps us to get to them on the weekends as well. The information sharing and the hotline, even though the hotline continues to be inundated because people are calling the hotline for medical emergencies, and people are calling the hotline just simply to find out if they still have to stay for 14 days. Questions that are important to them. But it's difficult sometimes to filter all of the calls that are coming in. So we provided as much PSAs as possible, and you will see public service announcements and handouts coming out now with respect to when to call, how soon you should be calling, what to look for, what are some of the red line signs that means that you must call at this point if any of these signs come up also, to avoid persons, as we are seeing some persons are, and the last 24 hours was no exception. Some persons are dying at home.
Yeah, regrettably so.
Minister, good morning again. And I'm so happy to hear the fact that our positivity rate are coming down, hopefully flattening, and the curve, that is the first sign that our curve is going to hopefully flatten and go in the next direction, and that to me is good news, especially in this situation with community spread. I am also looking at a percentage here of recovered persons to positive cases, and we look at as though we are about 50%, which is also a good thing, I think, because at 50% recovery rate, it shows that we are doing something right in a sense, and to hear that our hospitals are not fully inundated. We are 76 persons in hospital, probably with this rate of positivity where we were at 30% and the number of cases averaging 1,000 cases a week positive, you probably would have expected our hospital services to be a lot more occupied with COVID. So I think we have some positives there that we need to highlight. I mean, my question is going to be around, of course, Brenda touched on it, how are we going to go forward? And I know you have an announcement coming up probably tomorrow after cabinet meets today. And but do you think with that good news and positivity and what we're seeing, that the messaging needs to change now and to target our younger people, our behavior patterns, have testimonials and so on? Do you think that messaging needs to now change a little now that we're in this particular environment?
Yeah, Chris, I think that is worthy of consideration for sure, because at each phase of the pandemic, yes, you focus on different sectors and different forms of messaging. because it becomes the most pertinent or relevant issue at that specific time of the pandemic. So this is one of those phases where some of our young persons may begin to become accustomed to, or they're hearing of friends recovering, while at the same time hearing of friends dying, or family members, they may be hearing of persons recovering. And yes, the recovery rate, you will see that ratio between persons recovered and persons currently infected changing drastically because of the age of this pandemic as well. Because we've gone past what we call 2 cycles, 240, which a cycle is 14 days. So we're gone past 2 cycles. So persons are naturally clearing out.
Yeah.
So the relevant information now also focuses on level of vaccination, where messages will change, and also breakdown of hospitalizations between vaccinated and unvaccinated, breakdown of deaths between unvaccinated and vaccinated. Those are relevant information for us to look at now. Because as you see, when you have 1 or 2 deaths, it's difficult for the science to show. But as regrettably as the death rate has increased, it becomes more and more obvious the efficacy and the protection that persons get from the vaccine.
Yeah.
Is there thinking that as we move forward in this particular crisis that we're facing now, that businesses that were deemed non-essential will be given the opportunity now to probably open back up and resume, because there's a delicate balance between livelihood and lives, as we know, and I know the government is challenged with that, weighing that balance on how we do it. But do you believe that as we move forward with some of the positive news that we hear now with other aspects of this, that we could see some easing of that for some of the private sector companies, particularly the small ones and the medium ones that are seriously affected, the hairdressers, the barbers, and so on, if there will be some easing of that as we go forward?
Well, Chris, I think it's a discussion that has to be had within the groups of those sectors, as well as those sectors with the government. Because what you don't want is to recognize the stress that these businesses are under, which is most, because you've passed regulations to restrict their opening or prevent their opening right now. And then in recognition of that stress and need for financial sustenance, so to speak, you give them an easement, and they're only able to open for 4 or 5 days because they naturally close again because they become infected or their employees become infected. So the discussion also has to be had, what do we do when we do open up, whenever that time is, and whichever sector or business that is? How do we ensure that when we do so in a sustainable manner?
Yeah,
that we do so fully vaccinated, those are, and we do so with enforced protocols on the job site.
Right.
I am of the view, Minister,
because many sites had become complacent, because if everybody was practicing social distancing at the job site and all job sites had made the necessary adjustments, even if they still had poor rates of vaccination, many people were concerned about being infected at the workplace, where it actually was being infected in the community.
Right.
But a lot of those concerns were expressed that if a colleague worker of mine tested positive, therefore I'm coming to get tested, and not recognizing that it's in the communities. So it's a double-edged sword.
Really
they need to consider opening for economic sustenance, but we also need to make sure that if and when that does happen, it happens as safe as possible. So yes, I'd like to hear the discussion among these groups about being fully vaccinated, serving fully vaccinated, depending on their customer base, etc. Right. And I'd also like to hear the discussion among these groups about ensuring that workplace protocols are enforced.
Minister, I'm confident that conversation can happen. Of
Yeah,
course, you know,
yeah, has to
our
happen.
critics will talk about dividing the country along vaccinated and unvaccinated. And I mean, I have no issues about that in the sense that it is what it is in terms of where we are with community spread. And we know the figures is indisputable in terms of when you're vaccinated, the nature of if you get positive, what will happen to you in terms of serious illness and death versus unvaccinated. But on the question of variants, I know recently we had that news piece going out about variants, and Grenada might be involved in probably other variants apart from Delta. Is there any information regarding that from where you sit?
We don't have anything credible. We have continued to test through CARFA random samples, and significantly, I say significantly in terms of 90% of them have shown up to be Delta variant, and the other 10% have been either what's referred to as inconclusive, meaning that by the time the sample got there or the sample size, they could not determine. Not that it's something new that they hadn't seen yet, just that they could not determine. And we have picked up a couple of the older traditional alpha variants, etc., which we knew we had circulating within this region before. But like everywhere else in the world, I mean, this virus is consistent. Everywhere else now it is Delta, and Grenada is no exception. Proof is not just in the fact that we're coming back with the sequencing saying so. Proof is in the numbers as well, that the infectious disease experts can also identify which, to a relative degree of accuracy, which variant it is based on its exponential spread.
Right.
Byron?
Mr. Campbell?
Yeah. Morning, Minister again. Look, I just want to say, you know, we as a nation, we're very pleased with the work, the sacrifice being undertaken by your ministry, all the head workers and the volunteers. We just want to big them up for this. You know, this is a big deal. Minister, if you can tell us what are the specific factors guiding the cabinet or yourself in terms of the measures that are taken as we go through this first wave. In other words, you knew where we were 2 weeks ago. At this point, having evaluated the numbers and other factors, what are the specific factors, the numbers, the advice from the health science that will determine the new steps going forward, the restrictions, whatever? And the other question I have for you, sir, recognize this is the first wave, and there would be more, and we have to learn to live with the vaccine, with the virus. We've seen what other countries have done, whether it's Antigua that have instituted certain measures regarding vaccination for public workers and other workers. Guyana, we've seen Europe, Italy, for example, that have mandated that and other European countries, that all workers, whether from the private sector or others or public sectors, cell-phone businesses must be vaccinated. In other words, what we're seeing internationally is a mandate, a compulsory mandate for workers to be vaccinated. In our case here, if you could enlighten us regarding schools, should teachers be vaccinated? You know, what is it thinking within the government right now in terms of looking at strategies going forward to deal with the midterm and long-term management of the virus?
Yep, Byron, priority one of the cabinet is the safety and the lives of our Grenadian citizens. Priority two is livelihoods. Never before has there been a difference. It's usually lives and livelihoods. But in this instance, with this dreaded virus, there is sometimes a separation between the lives and the livelihoods. I have consistently spoken about trying to find that balance, and we will continue to try and find that balance between lives and livelihoods. And that guides our decision-making process as we go forward. With respect to the issue of vaccinations. Byron, I'm the Minister of Health. I want people to get vaccinated as much as possible. And whatever tools of convincing persons, persuading persons, educating persons to be vaccinated that are available, I would like us to consider using. But I'm also an elected official, and I do feel the pulse on the ground. And we need to consider how effective forceful measures would be, as opposed to engagement and education and persuasion as best as possible. We do need to consider this, because while we do see other countries have passed regulations, etc., the jury is still out as to how successful they are. If they are successful, then it is a worthy consideration. If they are not, then it is not as worthy a consideration, or that we must learn the lessons from their strategies and adjust accordingly. The fact is, I think you and I agree, and many persons out there recognize now, that the only way out of this pandemic is through vaccination of our population. What we are going to possibly disagree on, and I hope respectfully disagree as a nation, is how we get there. And that is the discussions that we must have over the next couple of days and a week, because I don't think we have that much more time. If we delay up or procrastinate on how we are to get to fully vaccinated levels, while respecting those who still have their level of vaccine hesitancy, while respecting those who still have a different opinion, but recognizing that time is of the essence.
Minister, my final question here has to do with the health services, the health infrastructure. Clearly, you indicated it's stretched, it's challenged right now, but anticipating increases in hospitalization, because certainly that's the trend, that's where it's trending. What are the measures you're contemplating or have in place to provide continue the provision of essential health services, particularly in dealing with the COVID, as what you have now becomes inundated, sir?
But today we have two teams coming in to assist. One team from Mexico, doctors and nurse practitioners that will give support and easement to our ICU team, our hospital team in general. And another team led by one of our proud and patriotic Grenadians, Dr. Philip Bonaparte. He's coming down with the team as well to lend support. And we have others coming in. SGU has tapped into their alumni, and they will be coming in so that they will be giving easement at all different levels and support to our medical team that has been on the front lines and bearing the brunt of this to date. So that part is the assistance for them. The actions that we take in society is what prevents or delays or slows the hospitalizations and the deaths. I've said before, and I think what I need your help with, all three of you getting out there and explaining the phrase and coining the phrase, so to speak, is that community behaviors and habits have to change to control community spread, and then in the future, to prevent community spread from coming again, community behaviors have to change. It's not about quarantine and borders, etc. and so, no. It's around us all over. And when it does rear its ugly head, however it rears its ugly head, we need to make sure that the community behaviors have changed so that it doesn't spread like wildfire throughout the community.
Right. Minister, before we let you go, because we have two other erstwhile gentlemen waiting to have a conversation about how we move forward, and talking about moving forward as it relates to our handling of the COVID deaths. I know last week we saw a refrigerator that spooked the whole nation, so to speak. And I know that funeral homes are basically kind of reaching their capacity now, and capacity in terms of being able to store dead bodies. And there's also special protocol for how you deal with COVID bodies. So they're now, they're putting things in place as to how they deal with that. So have you met with the funeral homes, and what were the outcomes?
We have met with funeral homes as well as representations from all sectors of the religious community. We have come up with a consensus, and that consensus will be announced collectively later today.
Okay.
I don't want to steal any wind out of our collective sails.
Right.
I'm respecting the fact that we met together. We discussed this most difficult situation.
Right.
And we came up with a consensus, which we will jointly release, I think, by 4 o'clock today.
So you said funeral homes and religious entities.
All representation from all religious sectors in Grenada.
So I guess that's taken into account what will happen, once we have a dead, how it is buried, the rights that we are given, the time, and all of that. We can expect that?
It is, yes.
Okay.
Those were the issues that were discussed, and a consensus was found.
And the refrigerated container, you want to address that? It really spooked us, sir.
I think it were two reasons. One, it's an issue that we hate having to come to terms with. And two, there's certain agents out there, and that's all I'll refer to them as, agents out there who thrive on misinformation, disinformation, and trying to discredit the administration. And it was actually wherever that so-called leak or misinformation, because the figures weren't accurate, but the trend and reasoning given was what was true, that they needed additional space. But it was disrespectful to that same process that we were engaged in, that someone went out and leaked. While the very same individuals were sitting at the table out of mutual respect for each other, everyone else was respecting the process and the confidentiality of the process until we came to a conclusion and let the public know collectively to go out there and sort of jump the gun, so to speak, and also give wrong information was disappointing. But this is the world we live in. This is our wonderful democracy that we are proud of, even when individuals are allowed to thrive on disinformation and trying to discredit the authorities. I think as a leader, we take pride in the fact that our democracy even allows that lowest level of individual to thrive. We are where we are. We need to get past this. We need to get past this together. In unity, we will find our strength. But there will still be some who choose to go off on tangents for whatever objectives they may have or reasons they may have. But I think the majority of us are still holding together and coming together even stronger.
Yeah. All right, so we expect an announcement today, how we're going to be handling moving forward. And before we let you go, Minister, what is what is morale and the mood and what is the state of the healthcare professionals who serve under your ministry? How are they doing?
But we've had tremendous turnouts of volunteers over the weekend, and that really has boosted the morale of our frontline workers who've been there 24/7. Throughout, seeing people come forward and assist and getting meaningful work done in the process. For the team at the General Hospital, I think today's arrival of relief teams and support teams are going to make a big difference for them in particular. These are, and one in particular is a team, I'm told, that has been responding to almost in almost all of the hotspots that have shown up in Latin America and the Caribbean. So they've been fighting this battle and giving support, because that would be the normal policy for most public health authorities, is that when you're in the heat of the battle, you call for the additional troops and support. And here is a team that is coming. That's going to make a difference. But I think most importantly for our healthcare workers on the front line is seeing us as Grenadians coming forward, complying with the regulations, wearing their masks, trying to make a positive difference to prevent ourselves, from ending up being further wards of our healthcare personnel. Getting vaccinated, seeing those vaccination numbers rising, seeing more and more people being compliant with wearing masks, etc., is really going to help, because I hear so many times from our healthcare team of them witnessing previously, before this outbreak and the first 2 weeks of August, witnessing the activities that become super spreaders, witnessing people not wearing their masks, whether it is on public transportation or just simply in public or so. And them as healthcare workers recognizing most definitely the type of risk that we put ourselves in. Now them seeing people complying, seeing people come forward to get vaccinated, our community health nurses, and so this is an added boost. It helps them significantly to know that, yes, they're seeing meaningful progress in this battle. For our hospital team as well, these things help. Seeing that no movement days truly became no movement days except for vaccine and testing makes a big difference to them too, because it means that over the next 7 days or so, they can expect further reduction in hospitalizations, and so because people actually did listen. What happens today, moving forward on our actual business days, restricted business, but business days, makes a difference in their morale too, depending on how many people they see in town and what we are doing or not doing. That makes a difference in boosting the morale of the health team.
All right. Thank you, Minister. Appreciate you coming in. It's the third Monday in a row. And this is we
Thank you all.
Have it. Yes.
And stay safe and keep doing what you're doing as well. Thank you.
You do the same, you and your family. Truly appreciate all that you are doing together with your team in service to Grenada. And that is, I think, where we all need to rise now, in service to Grenada. Thank you very much, Minister Steele.
Thank you. Take care. All the best to you too, Chris and Byron.
Thanks.
All right. We take no breaks. We have a giant-sized program this morning. Of course, you're hearing from our Minister of Health, the state of play, and really great to hear that help is on the way for our great team of medical professionals. And now we delve into the matter of tourism. It's really, really important to Grenada. Lots of folks depend on tourism for their lives and their livelihoods, so to speak. And even for how the world sees Grenada is mostly through the eyes of tourism, whether it be sports tourism, education, and the like. And so it is a pleasure to have with us this morning, the second part of our program, the guest panelist, Mr. Barry Collymore. Mr. Collymore is the chairman, of the Grenada Tourism Authority, and Mr. Leo Garbutt. He is the chairman of the Grenada Hotel and Tourism Authority. Good morning, gentlemen.
Good morning, Brenda. Good morning, Byron and Chris, and good morning to all of the viewers and listeners of Perspectives.
First of all, we want to apologize for having you wait so long, as we had to get to important national matters with the Minister for Health. So we thank you so very much for your patience and your indulgence, Mr. Collymore.
I don't think anybody minds waiting on Minister Steele these days. There's nobody in Grenada that minds waiting on him.
All right. Okay, great.
I echo that.
And Hi, Mr. Garbutt. How are you?
Actually, I'm spectacular, thank you.
Ooh, nice to
It's
hear.
good to
I
be
like
here.
the word.
You bring up spectacular view to us as well. All right. So, gentlemen, all of Grenada really wants to hear from both of you as you really lead the engine and you're the drivers of what happens with tourism. And because of the situation here with COVID-19, of course, our numbers spiking and the CDC placing us on the on level 4, and there is anxiety this week about what is going to happen when the UK releases who's on amber, who's on red, who's on green. That is really the anxiety. I know lots of hotel operators, all tourism operators, and the employees and so on are waiting in anticipation to hear just what's happening. So, of course, Mr. Collymore, anything you can share with us in terms of airlift, in terms of what are you hearing from airlines, from our source markets? What's the news, sir?
Thank you, Brenda, and good morning again. I think the news is certainly not, we are in a particularly difficult position right now, but this position is a moment in time. It is not where we will be in 3 months. It's not where we will be in a year. We have a particular difficulty now. We are getting over it. We are, as I mentioned months ago, we have put together probably the best marketing team in the Caribbean, led by CEO Petra Roach and supported by many different persons in the sector here. And we are continuing to plan. And we, just this week, we saw Grenada, everyone was speculating that we would be red listed. Well, we were not, So we are, the news is that from a tourism perspective, and I'm sure Leo will back me up, we still think that there are tremendous opportunities. We're going after these opportunities, and we will not rest until we get the numbers back up. And we're not even satisfied with getting the numbers back up to where they were. We want to increase the numbers.
All right. You say that we were not placed on the red list. So we're amber?
No.
Well, go ahead, Leo.
I think we need to understand the situation with every country in the world. Mm-hmm. Tourists need to travel, and the reason they need to travel is because a lot of them are not as lucky as we are, in the respect that we live in a fantastic climate. So people want to travel to us. You take the situation in the UK, and you take the situation from March 2020, when the government were in a situation where they closed down the whole of society in the UK. That really hit the hospitality industry, and it hit the airlines. Now, nobody can make any money when they're closed down. Right. So what the government did in the UK, and what we can't do, is they had a furlough scheme, and the furlough scheme paid people to not work. And that is coming to the end at the end of September. So the government in the UK needs to open up the hospitality industry, needs to open the airlines, and needs to get people flying again. So there's no sense in closing down countries. They need to open up countries. Also, added to that, if you think about what has happened since March 2020, when this started, at the time of March 2020, we were all considering, we don't know how this is spread. And we were all concerned in 2020 about touch and touching various areas of surfaces and so on. We now know the way COVID-19 is spread, and therefore we can deal with it. And actually in Grenada, we have dealt with it all the way through from the beginning until August of this year in a really great manner. So Grenada, when it comes to the UK thinking of Grenada and putting Grenada on the red list, I never thought it would be possible, purely because of our history
Right.
Purely because of the way that we have dealt with things, and purely because everybody knows how things move forward on this. So I think that realistically, we're in a position where we can go forward.
Oh, that's great news.
And Brenda, also, don't forget too that Grenada is hosting the third test match, West Indies versus England next year. We got that designation for a reason, for not just for the excellent cricket atmosphere in Grenada, but also for the way that we've dealt with COVID.
Yeah.
So everyone understands that the whole world has COVID. This is not a unique situation that we are in. Everyone has COVID. We have a spike. Other countries have had spikes. Italy, look at New York. Look at New York now compared to a few months ago. Everyone is back partying and going out again because they've been vaccinated so heavily in New York. And everyone understands that there can be spikes, but everyone also understands that there's a way out of it, and that's vaccination. And that's the good news. If there's any good news from the last few days, is that our vaccination rates have gone up significantly, and they continue to rise.
All right.
There's also another area which is important, is that when we were talking about things with various organizations that we work with, we were talking about how we give confidence to the people in Grenada and how we deal with things, also giving confidence to our visitors. So one of the things that we worked between us, and I think it was a remarkable achievement, we were the first country in the Caribbean to make sure that all of our team members in hotels were fully vaccinated. So there's a lot of credit to the thought behind that. And our team members are now saying to us, with the events in Grenada, thank heavens we're fully vaccinated. Then after that, on the 31st of July, we put into a situation that we were promoting, is that we will only allow fully vaccinated visitors to Grenada to come in on flights. So actually, when we've done that, you think about the fact that all hotels are enclaves, and that the people who come to the hotels, the guests, they are in a situation where they are fully confident that all the other guests are fully vaccinated. The staff are fully confident that anybody that they come into contact with in the hotel are fully vaccinated. All of the staff on the properties are fully vaccinated. So what we have done is we have created an area whereby people can see that, yes, I'm safe. Also added to that, what we wanted to do is to think about the local population, and the local population seeing tourists out in the community, that they weren't concerned that that person is going to bring something to Grenada. It's impossible. So, and I don't think, well, I know that there's been no issues with tourists at all. In actual fact, we're in a very, very strong position. So I feel that the way that the country is marketed, the way that we have put things in place, Grenada is in a very good position. Although at the moment, the case numbers are rising, everybody understands that in the medical industry, in the medical world, and they know that the cases will go down, as the Minister has described earlier.
Senator Allie?
I want to put a question to you, but I want to give a contextual background. I was reading a Bloomberg report the other day that indicated that, COVID is here to stay with us based on the number of unvaccinated people we have. It's going to be around probably for the next 5 years. And businesses in particular need to adjust how we operate, how we deal with, how our staff interact, and all of that. And of course, what protocols we're going to follow and as we go forward in the next few years. My question to you guys, based on that analysis by the Bloomberg report, is two. We have heard one, that there is a request by some quarters that we increase the quarantine for visitors arriving from 2 days, 48 hours, to some people saying 7 days or more, and whether you think that is going to help with the situation. And the other question, of course, is as we move forward as businesses and as we are preparing to live with this virus and how we deal with it, the hotel industry in particular and the marketing strategies that we engage is going to focus more on vaccinated versus unvaccinated.
I just want to, on the matter of the quarantine period, Chris, I think that, you know, there has been a overemphasis on protocols. Sorry, not overemphasis, it's not overemphasis. There has been a tremendous focus on protocols and not, you know, sufficient focus on in the general population on getting vaccinated. And that is reflected in the vaccine percentages before this spike. And let me just say this, Grenada has, at the moment, and has had for the last few months, and has had probably for the last year, some of the toughest protocols, entry protocols in the Caribbean. The GTA just did a survey of 11 Caribbean islands, and Grenada had the toughest protocols. And I have them here. Among our protocols, for instance, we are the only island in this survey. We looked at Grenada, Antigua, Barbados, Belize, Bermuda, Dominica, Jamaica, St. Lucia, and St. Vincent. And we are the only island of those who people must be fully vaccinated to enter. We are the one of just three islands of that group that is requiring a second PCR. And there is no one in that group who has there's only one country in that group and that is Bermuda, that is requiring vaccinated people to quarantine longer than 2 days. So I think that this thing about 2 days and 4 days, that is a myth. No one has had any significant spread in the Caribbean based on a 2 or 4 day quarantine. And I think what we need to focus on more is vaccination. The figures refute that. And if anyone does any research on the protocols of the Caribbean islands, you will see that Grenada has the toughest protocols.
I think also when it comes down to it, obviously we're all very pleased that we're still on the UK green list. When you look at what the UK have announced, they've announced that people going back to the UK from being on holiday don't have to have a PCR test and they don't have to quarantine. So they realise that with nearly 90% of the UK vaccinated, that there is no sense in quarantine anymore. It's just irrelevant. So we need to look at the science, we need to look at the whole situation. And in actual fact, we all know that what has happened here is the community spread, and we can't stop that. As the minister said, it's got to play its course, and we've got to get used to COVID-19, and we will do. And so therefore, we've got to have the new normal, and we will have the new normal. And we'll, in actual fact, all of us are very sensible about things. This is another thing that's been thrust at us, like 9/11, Ivan, the financial crisis, and then now COVID-19. We're resilient people. We'll get over this.
To you, sorry, Byron, one more question before
go ahead.
I let you pop in. The issue of dealing with the confidence issue, and as Leo indicated, you know, the hotel plants now are deemed as probably enclaves and showing that how well vaccination can work in terms of increasing the confidence among the employees and guests and customers. And probably that is a model that our businesses should, in Grenada, follow. The question here is, as I asked Minister earlier on, do you guys, Barry and Leo, believe that the private sector now needs to come out in the messaging aspect and put out there that, listen, we have tested this. This is now working. We can show you. We have hotel properties and plants with vaccinations right around that is showing that we can entertain people, we can entertain our employees in a safe environment that works for all. Do you believe that we need to jump in that messaging and talk about that? And finally, in terms of the pop-up clinics, Leo and Barry, do you believe that this is something we need to do and get more involved as companies in the pop-up clinics to ensure that we understand clearly our profile and our figures as it relates to testing and who is positive, who is vaccinated, and who is not?
I think that, I think, Chris, you hit the nail on the head there when you talk about the model. There are two large employers in Grenada, very large, two of the largest employers in Grenada, that largely their business operations have not been affected by COVID. That's the hotel industry and St. George's University. And the only reason for that is that in both cases, there is 100%, pretty much 90, 99, 90, 95 to 99% vaccination of employees. This is the way to go. There are many businesses in Grenada today that cannot open, that are suffering from serious interruptions because of unvaccinated staff. So this is clearly the model to go. We could not have achieved what we are achieving now in the hotel industry if our staff members were not vaccinated. And maximum credit must go to the hotel workers. They're on the front lines as well. They took the decision for their jobs and for the industry to get vaccinated. And I think that is a model that has worked. St. George's University has gone on uninterrupted as well because of vaccines. But let me just say this to the second part of your question as well, Chris. I think that there needs to be now a stronger partnership with employers, unions, and the workers themselves. And that partnership needs to be a coalition, in a sense, to create a safe and healthy environment for workers. And it has to deal with up-to-date vaccinations, it should deal with healthy lifestyles, and it should deal with healthy workplace environments, where hand in hand, these groups work together to ensure that our workers are healthy. Because you know why? In Grenada, unlike many other countries, you do not have redundancies. You have maybe 1,000 police officers, that's it. You have 100, 200 stevedores on the port, that's it. You have, I don't know how many nurses you have, but how many nurses you have, that's it. There's no other region to call nurses from. There's no other region to call stevedores from. There's no other area in Grenada to call policemen from. So we have to look after, and the private sector has to play, I think, a bigger role in looking after the health and safety of workers. And up-to-date vaccination is one of the most important ways that you can protect your workforce and protect people's jobs and livelihoods.
I'll take the second part of the question when it comes to pop-ups. Actually, within the Grenada Hotel and Tourism Association, we've led the charge on this. We've worked very closely with the GTA, we've worked very closely with the Ministry of Health, and also we're trying to get the message out there as much as possible to be tested and to be vaccinated. Now, when it comes to the pop-ups, there's been some remarkable people who have volunteered their space. When it comes to Arlene Friday, who all of us in the Hotel Association are just amazed at the way that she has organized things. And then you take the volunteers that we've had. We've got some fantastic volunteers who are out there on the last 2 weekends and all the way through. We've sent volunteer people to work at the stadium because we know that the nurses and the doctors need to be vaccinating people, and they needed people to take all the data, and we volunteered on that. So actually, we've done our bit, and we continue to do our bit. The doctors who are coming in now from overseas, we're in a very good position because we've got accommodation, and we're accommodating them. So actually, the hotel sector has done an awful lot for the health of the nation, and of course we will continue to do so.
Mr. Campbell?
Yes, again, gentlemen, morning again, and your optimism, your outlook of the future and of the sector and what you've done so far, I must admit, have me feeling very, very positive, very good. So I just want to congratulate you on this. But notwithstanding your optimism, gentlemen, we are in a situation where we've been given a number 4 in terms of the CDC. I would like to know, has there been cancellations? What is your present occupancy? To what extent also have workers been affected in the pandemic? Do you think there would be a need in terms of because the industry, the sector, we need time to not reboot itself, but to gain momentum? What kind of fallout do you anticipate for the workers? And do you believe any relief would be necessary as you plan going forward?
Okay. Actually, what you're talking about there is the concern that we've all got. And the concern that we've all got is our hotel team members. Basically, we're very close to all of our team members, and it's very personal relationships because we're in the hospitality industry. So we're very hospitable to each other and the way we work. When it comes to the position of optimism, as I've expressed earlier, this is just another thing that we have to come over and make sure that we go forward in a positive vein. Now, when it comes to the position as it has been, there's been several areas that we have suffered. Obviously, we've suffered very hard initially because the closing of the borders. We all understood the closing of the borders. And the reason for that was to stop COVID coming in. There's no sense in closing the borders now because COVID's here. So then we unfortunately shot ourselves in the foot when we didn't have the phone at the airport. That didn't do us any good at all on our reputation with the airlines. Our airline partners are vital to us to get the passengers here. And also, one of the other things that has happened as well is that people have put huge amount of money into marketing. And actually, we just can't give up because we need the people here to keep people employed. That's our main motivation. So we've been through some very, very tough periods. But if we sort of say, woe is me, we're not going to get anywhere at all. We need to say, actually, we have got hotel accommodation and we need to make sure that's full. And also, one of the things that I need to express as well is that when we as hoteliers are selling resorts and selling holidays, it's not a hotel room, it's the whole resort, it's the whole of Grenada. And that's what we sell. So to think of a situation where people, going back to an earlier question about putting quarantine, to think that people will come to Grenada for, say, 7 days and spend 2 or 3 days in a hotel room, that's a big disincentive. And actually, that's not going to happen because it doesn't happen anywhere else.
Right.
I have one more question for Leo. We now heading into our peak season, the winter season, and I know bookings normally will indicate what kind of levels that you're going to see for the season coming up. Although these booking times now are shorter and not very much protracted in the future, how is that looking for your sector and your hotels, the plans as we look forward to the winter season coming up?
Or do we have a season?
Actually, when it comes down to it, there's a vital component here, and the vital component is the flights. Mm-hmm. Now, one of the things that, and I'm sorry if this is going to be a bit of a long answer, but if we don't have the flights, we don't have any tourists. So when it comes to us being thinking about us as Grenadians getting on flights, if you get on a flight you've got to thank tourism for the fact that the planes are here. We've also got to thank certain large hotels for their marketing and the way that they promote Grenada. And we are going to get more and more flights with more and more hotels being here. And unfortunately, yes, there has been cancellations. We've got several people who will say, actually, I'm a bit concerned about Grenada, and so therefore I'll cancel my booking. On the other hand, we've got lots of people who say they want to come. So there's a balance. And we've got lots of repeat guests who want to come into Grenada. And some of them can't get on flights because they're fully booked. Now, actually, with everything to do with the crystal ball that we're gazing into, I hope that we're going to have a good winter, and that's the way it looks at the moment. And certainly the fact that people have been cooped up for nearly 2 years now, a lot of people love Grenada, so they want to come. So I'm optimistic that we will be in a situation, and yes, we have got cancellations.
Yeah. Mr. Garbutt, do you think that what you explained earlier with the UK not really changing their position and really opening up the UK, that Grenada will benefit from that we will see the UK flights coming as they were planned originally?
Very definitely. Because actually, if you think about it on a worldwide basis, the UK cannot fly to the States at the moment. Right. So that's to our benefit in Grenada. So the UK government don't want to close down destinations where airlines fly to. And also when it comes to the logistics of putting aircraft in place and schedules, and also putting all of their staff in place, that takes an awful lot. It's not a tap or faucet that you can turn off and on. That takes an awful lot of planning. We're very lucky that we got BA and Virgin coming in twice a week each from the UK, and that the information that I've got from both of those organisations is that they think that they're going to have a good winter. When it comes to JetBlue and American and also the Inter-Caribbean flights, they're all good at the moment. But and also, I think there's this situation whereby we know what's going to happen because of the medical side of things and the way that we have handled things in Grenada. There's another thing that actually I should explain to you about. When it comes to people employed in the hospitality industry, there's 1,000 people that we talk to who are involved in the restaurants, and the restaurants are closed at the moment. Yeah. I think it's vital that we get those 1,000 people back to work. Yeah. Because what we have all agreed in the hotel industry is that we only will serve fully vaccinated guests, and all of our staff will be fully vaccinated. The restaurants have said that that's exactly what they want to do. Right. So if immediately you can get 1,000 people back to work. We in our sector have got about 4,000 people. Now, if we have got 4,000, so there's a total of 5,000 people in the hospitality sector. When you think about that, the average family of four, every day we are feeding 3 meals a day to 20,000 people. That's a big deal. And we need to make sure that that goes on. Then you get the multiplying effect. The multiplying effect is that for every hospitality job, there are 5 people employed, such as fishermen, farmers, supermarket staff, even banking staff, shopkeepers and vendors and so on, taxi drivers, tour operators. This is a big industry. Yeah. And if you've got children, invariably, what they are going to do is their first job might be in the hospitality industry because it's the world's biggest industry. And let
me just say something as well.
Thanks for highlighting the multiplier effect there. People often leave that part out.
Sorry. Let me just say something, if you don't mind, Brenda, which would add on to what Leo is saying. We have hotels right now. The general public may not know this, and I'm talking about large hotels, over 200 rooms, not small hotels. We have hotels in Grenada right now, over 200 rooms, that are running at 90% occupancy right now, even with this spike going on. We have our largest hotel, which is the Royalton, about to reopen, and they are employing now, re-employing hundreds of persons. In fact, they just sent me this list today, and they're even looking for more people. They're looking for lifeguards, pool supervisors, electrician supervisors, kitchen tech supervisors, food and beverage assistants, sommeliers, bartenders, porters, chef de partie, chef de cuisine, pastry sous chef, pastry supervisor, head baker, baker's assistant, butcher chef. I'm not calling the whole list, but these are jobs right now that qualified persons here can get. And they had a job fair. It attracted hundreds of persons, and they're still looking for more persons. So the direct impact on jobs is happening now, and there's even about to be a greater impact on jobs when the Royalton opens back up. The second thing is that don't underestimate the Grenada hosting that third test match against England. We need to use this platform to relaunch our tourism, and we have enough time, and by that time our vaccination rates should have risen enough that we can do a big relaunch of our tourism at that point to create a big splash and to showcase Grenada to the rest of the world. So those are the three. There is still a lot of good news in the tourism sector, but the main reason why we can still have this good news is because tourism employers and tourism employees are the best followers of protocols, and also pretty much 100% vaccinated environments. This includes St. George's University.
Right. Well, St. George's University is the biggest tourism plant, if we may say so. Mr. Garbutt, I just wanted to ask before we let you go, October, the final quarter of the year, which is normally the start of the traditional tourist season, October through December, what does bookings look like, or what did they look like last week to this morning?
In actual fact, there's a lot of people who want to come to Grenada, and we have got an awful lot of people who are making inquiries, and there's a bigger surge because of what happened last week in the UK.
Good.
So the Americans have been fantastic to us all the way through, and they have been traveling all the way through the summer, and that they have been keeping us going. So now we've got the UK fully back on stream. I'm pretty certain that we're going to have a good October, good November, and obviously I would like to think that's all of our hotels, and I'd like to think that that is the case, but we all need to make sure that we put our individual marketing in to make sure that anybody who's coming to our country knows about our property and knows about the individual properties that we've got, and then they can book them. The other good thing that we've got in Grenada is that our plant is very varied. So it's all the way through from backpackers up to very luxurious hotels. And the other good thing that's happening as well is that we have got hotels coming on stream that will do a lot of marketing for Grenada. Barry mentioned Royalton. We've also got Spice coming back in October. And then we've got Six Senses coming along. And there's other hotels as well. So in actual fact, any of you who've got children and you think that there's a good position for them to go into, the hospitality industry is fantastic. Also added to that, when it comes to teaching people, we've got the West Indian School of Hospitality. So we've got a lot going for us in Grenada, and a lot of us think that we haven't, but we have. So we need to be saying Grenada's a great country, and also, you know, our reputation when it comes to tourists and to tour operators and to travel agents. They just love the fact that this is a safe destination, and the safety of the person is vital when people are making decisions. So we've got to think of our communities. Our communities have done a tremendous situation there. So have all of the governments that I've lived under here. Grenada is a safe country, and that makes us very attractive.
Right. Thank you very much. Thank you, Senator Allie. Mr. Campbell, anything else?
No, I'm good. And wrap up just now.
Mr. Campbell?
So, yeah, well, I was thinking, I mean, he was making a point regarding the employment opportunities for so many Grenadians and families with children in terms of see the tourism sector as an opportunity. But one area that bothers me to some extent in this way, that still we find that we have a very limited amount of management staff as Grenadians. So I think this is something the industry should look at. How do we promote, encourage more specialization at the management level in this sector? But I just want to close in saying that in terms of for the gentleman, that the optimism is really amazing, and the stability that they express. I think that as we go forward, we still have to be careful in contingency planning and measuring what's happening here in terms of, as we see the numbers, where they're going, how they're spiking, and how the international community, yes, even the UK may be advising, and the US certainly, the citizen in terms of traveling to Grenada. But clearly, this industry is significant for Grenada. It is essential for Grenada, and I really appreciate the approach it has taken, particularly regarding vaccination and just the standards and environment that they created. So I want to thank you gentlemen for certainly this approach.
Byron, if I may just jump in here just to address the issue of management, if you're hearing me.
Yeah.
In terms of management.
Yeah.
I think that we don't understand how much Grenadians play a role in management of hotels. If you look at our big hotels, the top hotels, you look at Spice, which is pretty much 100% Grenadian management. So is Calabash. You look at True Blue Bay. You look at, and then when you look at even the chain hotels, the bigger brands like Sandals and Royalton, they are investing heavily in management training. There are a number of Grenadians who are training outside of Grenada, getting training outside of Grenada, and bringing that training back into Grenada. In fact, when I looked at the Royalton opening team, that is the team the management team coming back in to open the hotel, there were, I think, 6 or 7 Grenadians who were trained on the Royalton, who are coming back now, who were trained as managers, who are coming back now to help open this Grenada hotel. So there's a lot of Grenadians serving as managers, but also what we are doing with the West Indies School of Hospitality with Cornell University is going to boost that even more. It is going to give persons more training and more opportunities in management. So I just wanted to make that point.
Great. Good thing. Okay.
Actually, one of the things that Barry has talked about is obviously people of an employable age. What we have done, Lyden Ramdani and I, trustees of Grenada schools, and we're into early learning literacy, and we built 25 libraries in Grenada at various primary schools. And what our ambition is to make sure that we teach children to read, and then they read to learn for the rest of their lives. Mm-hmm. So there is a bigger ambition, And the bigger ambition is that when it comes to Grenada, we want to have the most literate children in the Caribbean, and we can do that. So therefore, when it comes to your question about management, what we're doing is right at the beginning, we're giving children the basis of using their brain and teaching them to use their brain. Then they will be thinking, actually, I can do good here. I don't have to leave to improve myself. And then with the industry that we're in, as I've said, it's the world's biggest industry. There's so many opportunities. And what we need is Grenadian management. So we need to give those opportunities. So we've got it at both ends. We've got it with young children. We've got West Indian School of Hospitality. We've got a lot going for us.
Thank you. Thank you so much, gentlemen. Your final words, Mr. Garbutt?
Actually, I think you realize that when it comes to the position that we're in, yes, it's dire.
Yeah.
But however, if you need to get down to the bottom to go up, and we're on the way up, and we need to keep pushing in that direction. We need to make sure that all of our partners are doing their bit, and in actual fact, we encourage people and our partners, and we're doing that. Everywhere that we talk about Grenada in a positive manner. Unfortunately, all of our suppliers are doing that as well. So thanks very much for this opportunity to be with you. Yeah. I think that realistically, we've got a great country. We've got a great nation between us. If we're all fully vaccinated and we get up to the point of herd immunity, actually, Grenada is the rising star of the Caribbean.
Thank you. Thank you so very much. And thanks for all you do. Mr. Collymore?
Thank you, Brenda. I just want to end by saluting the hospitality workers. I think they have been on the front line as much as anyone else. Mm-hmm. Many of them have, they've all gone out and gotten vaccinated. And many of them have, people don't know this, but there are many hospitality workers who have continued to work. Some are on half salary or a portion of their salaries, and they have continued and they've kept the plant open. And now they're coming back to, a lot of them are coming back to full pay because the industry is rebounding. But I just want to say that this is an excellent example of dedication, commitment, and I think that saluting the doctors and nurses who are on the front line is extremely important, and we have to do that. But sometimes we forget the hospitality workers, and I think they have been a model and a model example to how we end this pandemic. So I want to 100% salute to them, and I hope that people recognize the tremendous sacrifice that they have made, because they're the ones keeping the sector open. Also to the business owners who are up at night thinking about how new ways, innovation and all of that. Again, they've been a tremendous example. We have to follow the lead of the hospitality sector, which is 100% vaccinated. It's the only way we get out of it. Protocols slow the virus, and we have been extremely fortunate, one of the few countries in the world to slow the virus for so long. But it was bound to happen. We were bound to have, especially with this very virulent strain of the virus, we were bound to have a spike at some point. There's no country that has not had a spike. And now we're in it, but we will get out of it, and we're extremely optimistic that we will. So thank you again, Brenda and Chris and Byron, and thank you for inviting us, and yeah, thank you.
Thank you so very much, Barry. Really appreciate it. And yes, our commiserations and thank yous to the hospitality sector. You're right, often forgotten on the front lines of so much incoming, and they're still standing. So thank you for that. Thank you very much. Have a good day. Keep yourself and your families and your businesses safe. And thank you so much, Mr. Garbutt, and for your contextual explanation of just how the decisions the UK made is going to impact us in a positive way. I don't think we ever got that perspective. So thank you. Have a great day, gentlemen.
Thank you. Thank you. Have a great day.
And
You too. Thanks.
Bye-bye.
Bye-bye.
Thanks.
Gentlemen, that was a long pants one this morning.
Yeah,
It's almost 9 o'clock.
Chris, you could.
Yeah, I want to say a few words to wrap up and be a little controversial as well, probably.
You're always being controversial.
And I wouldn't talk about the Senate.
Controversial spikes you.
It's his nature.
Spikes you. I mean.
You know, Byron.
But that was a really good conversation, though.
Listening to Mr. Garbutt and to Corey, Mr. Collymore, I mean, it is clear in my mind that, you know, the hotel sector and the hotel industries and plants have set the example. I think they have shown what vaccination can do and what it cannot do.
Yeah.
And I want to make a special plea for our small businesses, the restaurants, as Leo indicated, and other small affiliated sectors and industries. You know, the tour operators and so on, and other businesses in our society that, you know, we in that business community have invested a lot of money in protocols, ensuring staff is trained properly, following up the protocols, creating that safe environment. And I think we need to be rewarded by giving us some degree of opening up and some measure of release. And that gets me to the issue of mandate and mandatory vaccinations. And, you know, I've always promoted that mandatory vaccinations is something we should have done a long time now for our security forces and the allied people attached to security like customs and so on. And I still hold the view now that it is even more important for us to look at how we move forward and march forward, understanding that COVID is here to stay with us for a few years.
Yeah.
And I believe the time is coming. I think Minister alluded to it, is rather now shorter than longer, for us to make more firm decisions as to how we move forward with our vaccination programs. And I think that there is very little time, precious time left for us to be on the fence and still hesitant. We could use the hotel sector as our shining beacon as to what vaccination can do and cannot do.
Right. Point.
And I ain't talking about Senate.
You're not talking about the Senate?
Not now.
We'll talk about them next week. Mr. Campbell, we're not letting it get away.
Absolutely, whether he wants to or not.
Yes.
I just want to endorse what's been said. I think this morning we heard a lot. What I want to highlight here is the vaccination, and just to emphasize that that there will be vaccination locations all week, Monday to Friday at the National Stadium, and all health clinics around the island. That's amazing. All health clinics. So it means that wherever you are in the community, once there's a health clinic in your area, you can be tested and you can be vaccinated, certainly. So I think this is amazing. A lot of resources are put in out there. We big up, as I said, the volunteers and all the people that are out there working. We have to do this. We can and we will. So I think this morning, certainly what I got from the hospitality sector is optimism and hope and pride also that in doing this. So we'll do it.
Yeah. It was more than optimism. I mean, they were really able to say what's going to happen between October to December, and that's critical for the industry. And so that also speaks to Senator Allie's point that there must be some consideration for how we put the hospitality sector back to work. And Mr. Garbutt made a very, very important point, how much restaurants and other allied facilities, how they support what the hotels does. So it means that restaurants and bars and so on have to go back, and farmers as well. Well, farmers are now on.
Thank you, Chris.
Farmers are but I mean, come on, farmers are now on our essential list.
That's correct.
The thing is, yes.
And farmers and fishers.
That's correct.
Before my senator colleague,
let's not even go there. They're now on our essential list. The thing is, with the hotels and all of that having business, it would now give them more of an opportunity to earn. revenue.
Yes.
Yeah. So let's just, but in terms of the restaurants and all of that getting back, it has to be really looked at in a very safe scenario, even if it means that, and at this point, it really means that they can't open up to vaccinated clients.
Yeah.
You know,
that is the point.
That goes without saying.
We have social distancing, we could vaccinate. Come, if you're vaccinated, come. Staff vaccinated, let us operate.
Correct. And the considerations this morning about, the new today about the regulations, we see where the numbers are, so we know that there's not going to be a lot of changes with those regulations, I don't expect. But in terms of the no movement weekend and all of that, I think we starting to feel a little, we need a little
cabin fever.
Yeah, we need, maybe one day, that's just my suggestion, maybe Sunday, but I think we need to kind of, because people, we're having all of this going on and then we're still boxed in. So there need to be some sort of measure for balance of the human, psyche. I just like to say hearty congratulations and commendations to Sister Daisy Hazard. Daisy, I call her Days. Congratulations, Daisy, for coming out so openly, stating your own fears you had of vaccination, what it meant to you, what it did for you, and in terms of encouraging the members of the Public Workers Union to go on out and get vaccinated. All right, I think what you did in terms of sharing your personal story, as well as being a leader in your union, it really would help and motivate others to do the same. So congratulations for doing that, my AHS sister. And of course to the Brian Grimes, the president of the union as well, who has made a statement, so let's just encourage each other and let's move on. Let's save Grenada. Let's just do this for our country. We're going to get to all the other things.
Let's get back to pure Grenada.
We always, the spice of the Caribbean. We still spicy.
That's right.
We ain't so pure now with the COVID, but we're still spicy. So that's our program this morning. It was a really long one. We had to do it. It's really important that we have these national conversations. And we'll take up Senator Allie on the little duel in the Senate. We like we take, right?
Next week.
So next week we will deal with that. All right. So thanks everyone, all of you who tuned in, who stayed with us this morning. A lot of you are still here. We thank you so very much. We really appreciate you. We couldn't do this without you tuning in every week. And so to these two great gentlemen, Senator Christopher Allie, who gives up his time, many calls on his time as well, who really gives up his time, to come in and share his views, as controversial as they may be, some of them.
At least you're not bullying me.
We live in the world. No, I'm not. One thing, I'm not a bully, and I don't take bullying easy. I gotta tell you that some of you are passive aggressive with the bullying, eh? And I'm here I am here to debunk it. And Mr. Byron Campbell, thank you so much. We appreciate you. The nation appreciates you. Thank you. I just come in to keep the decorum and from time to time run my mouth. That's it. Thanks to Richie Oliver, our executive producer, Kirk Oliver, who has kept us crisp and clean this morning. And to Blondell George, our director, Nazim Benjamin, providing professional streaming services. And to Mikey Live, KG9, Sister Island Carriacou, TNR Communications, Partygrenada, MTV On Air and Online. We thank you. And our own Perspectives page. I'm Brenda, Baptiste, your moderator. Until next time, stay safe and try to be positive. Be positive while you stay COVID negative. See you next Monday. Bye-bye.
Bye-bye.